and welcome to Legal Affairs. My name is Diamond Liddy, and I'm the public defender for the 19th Judicial Circuit. We are going to be talking about something that is very, very important to our community, to our children, and we're going to learn all about something that has made, I believe, some really great strides, and we're going to hear about those statistics in a minute, too. Welcome, Kevin Howard. How are you this morning?
I'm great. Thank you for having me on your show today.
No, this is great. Before we get into this great program that has been established in St. Lucie County, let's start with you. You work for the Florida Department of Health,
That's
which
correct.
is different than the health department.
No, actually, it is still the same. It's just a name change.
Okay.
Yeah, just legally, it just went into calling and being universal all around for all the counties that the health departments are represented in for the state of Florida. It's now the Florida Department of Health in St. Lucie.
Okay.
You'll have the Florida Department of Health in Orange County or whatever county that they're in.
Gotcha.
But it's still Florida Department of Health.
Okay, but your office, the office you work out of, and the program that we're going to talk about today, you don't see patients. You guys don't. Your office isn't the clinic where people go. You have a separate office where
That's correct.
C?
We're located on 714 Avenue C.
Right.
That is correct.
And just so the viewers know, the actual health department where you go if you're sick, where is that located now? Because that's changed.
Right.
Hasn't
That's
it?
actually on Milner, off of Midway Road.
Okay.
Which is the north, part of Port St. Lucie, or right there on Midway, next to the fire department.
Gotcha. Gotcha. Okay. So let's talk about you. How long have you been with the Florida Department of Health?
I've actually been with the Florida Department of Health for 2 years.
Okay.
2 years now.
And where did you work before that?
I actually was in the school system, so I had some. My background had some educational background. So,
right.
Came from that. Came into fourth years.
Teaching?
Yeah, I was
What
into
did you
teaching.
teach?
I taught ESE. I did 4th grade. So I've kind of done the gamut of some of things in the system through the St. Lucie County and as well as Martin County systems.
Okay, and then what made you decide to make the change?
Well, location, and in the educational field, things are always changing, things are always moving around. So ended up taking some time away. Wanted to do some things on my own. As far as some behavioral things and things of that magnitude, did that for a little while, and then decided this opportunity came about and was presented to me by a friend. I took the opportunity, went and met with the department and the people in the department, and the rest is, history.
Okay, so let's tell everyone what we're going to talk about. It's a program called...
It's Teen Choices. It's called Teen Choices.
Okay.
Through the Department of Health, as well as funded through CSC. And Kids Connected by Design.
What's CSE?
The Children's Services Council.
Okay.
All right.
Okay.
We have part fundings from the Health Department, part fundings from the Children's Services Council, as well as funding from Kids Connected by Design.
Okay.
Those programs have allowed us to be able to put this program out and offer the program to the teens into the community of St. Lucie County.
Okay. Is this unique in St. Lucie County, or do they have other Teen Choices programs throughout the state?
They have the departments have other programs like this. It's different, but the funding may come from different sources.
Okay.
But most of the counties are teens, having to involve teens and being able to educate the teens and allowing them to understand their options and the choices and to make better choices pertaining to their health.
Well, so this is kind of, the funding is different, and have you tweaked it and kind of made the program different than the other ones throughout the state? Or do you have a model that you have to go by? And
no, we don't have a model that we went by. So every department is kind of
that's what I was getting.
They're kind of different. Every department.
So you were able to develop.
So
when you were hired, you could do what you want.
Well, the program was already developed. It was already established, and then we just came in and you kind of put your own unique flavor to it, because everyone's different. Who all works as far as the kids. Every community is different.
Every teen group in the community is different.
That's exactly correct. So you're able to put, once you see the layout. You're able to put you into it. And then all it is, Diamond, is just being able to talk to the kids on a one-on-one basis and educate them and allow them to see what their options are and to make proper choices when they're faced with whatever situation they're faced with.
Okay. And in respect to this Teen Choices name, it is about sexual activity, that kind of thing, HIV, education, educating them regarding, I'm sure, sexually and I'm not trying to steal your thunder.
No, you're not.
Sexually transmitted diseases, that kind of thing. So tell me in a nutshell, it's primarily educating teens.
It's educating, yes. It's health prevention.
Okay.
Pretty much what it is. So whatever that may encompass, which we know can encompass a lot of things, from all those topics that you mentioned,
right?
The STIs, AIDS, HIV, making them aware of the difference, making them aware of how these diseases or how these infections are contracted, and then also we've branched out and we've talked about healthy relationships. We're finding out a lot of teens don't understand what a healthy relationship is.
In what terms? You mean emotionally and not?
Emotionally, also being able to know whether they're being abused in a relationship.
Right.
Whether it be mentally, physically, verbally, to understand those type of things. So we've talked about that. We also talk about some of the things that are going on that they're dealing with now, because we all know we live in a world of technology. So there's cell phones. Everyone has a smartphone now. And we know that sexting and these type of things, inappropriate things, are happening on phones from as young as, 9, 10 years old on up. So we educate them on those things and how sometimes their cell phones or some things can be used against them. How once they send, with social media now being so prevalent now and the big thing that's going on now, we want them to understand that sometimes social media for a lot of people may not be their friends. People can use them in a negative way and not always a positive way.
Right. Okay, so how does this work, Kevin? You have a classroom and you sign people up, you go out into the schools.
All of those things.
Okay,
yes.
So tell me.
So what we do is, it's because our program is 100% volunteer. What we do is
it is 100%.
It is volunteer.
So you're the only paid person in the program, or you're?
No, I have there's another female caseworker that works with the females. I predominantly work with the males.
Okay.
To educate them, and we just, all those above that you mentioned, we go out and we try to hit the schools. We try to be able to, whether it's communities in our churches, local organizations, Boys and Girls Club, Lincoln Park Community Center, wherever you're going to find teens. I mean, I've gone to where I've just, because I love sports, I'll go to the fields, I'll go to the basketball courts and sit and talk to kids and just, hey, let me tell you a little bit about this program that we have. And then they get to choose if there's something they want to be a part of or if they don't. So
how long is, if you're enrolled as a teen, and when we're talking about teens, are we talking about 13 to 19 or predominant? What is what's the majority of the teens?
Our age range goes from 13 to 18.
Okay.
18 years of age. Now, if a person is still in school, say a little longer than that, as long as they're still in school, we can still be able to case manage them. And usually the program takes anywhere from about 6 months to a year of actually, depending on the behaviors that the young person is exhibiting. Because now you have to understand, we've seen behaviors from a person who just wants plain out education. They just want to know and be able to make decisions.
How can I prevent getting AIDS? How can I prevent getting STDs?
Exactly.
How can I? But isn't it kind of simple? How in the world? And I know we can't. This is a family program, and we're not. But still.
Well, you'd be surprised, and the reason is because there is a lack of education.
Okay.
There is a lack of knowledge. A lot of kids we see sometimes, or we talk to, they're getting information from the wrong sources. And with that, then they'll tell their friends, and they'll tell their friends.
Right.
But they're not getting that proper information. Unfortunately, a lot of things have been taken out of schools for whatever reason.
Yeah.
And they're not able to do that. Also, a lot of teachers don't want to touch these certain topics because that may be something that they're not involved in and they're trained in, and which is understandable because some people are uncomfortable talking about these things.
But the worst thing, you know, the worst thing that can happen is that we don't talk about these things.
Exactly.
Ignorance is not bliss in this arena. Kids have to know what they can expose themselves to, a lifetime of disease.
Correct.
That, you know, obviously, you know, AIDS is not the killer that it used to be, but it can be. And it's certainly, if you get it, you may not die from it, but it's not a walk in the park for the rest of your life.
That's correct.
You know, so anyway, and Kevin, while we're talking about this, because I really do want to know the format, because I still don't have it clear in my mind, but, you know, there is a fear factor in all of this. And I think not only educating them on how not to get disease, how not to contract AIDS, those kinds of things are important. On the other hand, taking away fear, so they're, you know, you don't want a girl not, you know, afraid to kiss another boy because she thinks she can get AIDS if she just kisses him on the cheek. You know, that's not healthy either. I mean, so go ahead. So how does this work?
And that's what we do. We want to educate them and answer all those questions that they may have that they've heard from somewhere else or some other source. We want to be able to educate them, to let them know that just as you said, that kissing someone on the cheek like that is not going to necessarily mean you're going to contract AIDS, or you're going to contract HIV. So we want to educate them. We want them to understand these things so they don't have the fear of that. But we also want to make sure that they understand that when or if they come across someone who may have some certain symptoms, these are things that you want to look out for. So we also want to make sure that we educate them in terminology that we use, because like we've kind of gone away from the word disease. We don't really call it sexually transmitted diseases.
What do you call it?
It's now called STIs, sexually transmitted infections. And here's the reasoning is because most people, if you go to a doctor and the doctor tells you, you know, Diamond, you got a disease, or if someone says you got a disease, we think that's the end. That's it.
Okay.
But when there's an infection, and when you're talking about young minds,
infection, you take an antibiotic and you're going to be okay.
Exactly. For the most parts, most of them are treatable. So we want them to understand that. So we try to take away some of these things that hopefully will take away some of these fears from them that you were talking about. So we educate with different terminology, different language. But we also try to educate adults. One of the things that when I came on board and started finding out is that a lot of adults had the program pegged in the wrong light, and they had the program pegged in the wrong manner, thinking that it was all about promotion. And the program isn't about promotion, but the program is about, I had the opportunity to speak before some educators, psychologists, school psychologists and things. And one of the things I made them or tried to get them to understand is that take yourself back to when you were 14, 15, 16, 17 years old. And you met that guy that just you thought was just it. You know, and things were happening. Things were going. So we wanted them to understand these are the same things. It's still the players change, but the game is still the same. So we wanted them to understand that so that they could help us better to educate those kids that maybe they couldn't talk to. So we've done that to promote the program in a positive light. And then to get the kids to understand that these things do occur. These things are going to happen. Here's what happens. Make a choice. Hopefully it'll be the right choice. But to have all that information to be able to make the right choices. Now,
do you touch on pregnancy? I'm sure you do.
We do. We touch on anything health related that the young kids are going to come across in their teen life. Relationships, pregnancy, sexually transmitted infections, how you can contract these things. So yeah, we definitely deal with pregnancy and talking to them. I try to make sure the young men understand that hey, it's not just a young lady's responsibility to protect themselves, because I get a lot of young men that say, hey, it's for the girl. I'm good. I don't have to. But I want them to understand to take responsibility also.
Right.
Because the both of you are in that.
Guess what? They're going to be responsible.
They're going to be responsible. Because if you're not, when a young, and something happens and a pregnancy does occur, you need to really be a part of that and step up. So I try to get them to understand that. Most young men think they're invincible. Yeah. Unfortunately, it's not going to happen to me. I'm protecting myself. But they're getting, like I said, they're getting this wrong information. And then when a teen pregnancy occurs, now they're like, okay, what do? I don't know how to handle this.
Yeah, I don't know what to do.
I don't know what to do.
Right.
Because I didn't expect this.
Well, okay. First question is cost. What's the cost?
There is no cost.
Okay, which is a good answer.
It's a good, yes.
When they sign, okay, I'm a 14-year-old. I want to learn about teen choices and ST, all this stuff. Do they go to the health department? Is there a classroom that I know you proactive and go out to the schools and speak and stuff, but I mean, is there actually class sessions Tuesday from 6 to 7 to learn, or how does it work? Actually,
how it works is there's the registration form.
Right.
And they'll fill it out. The case manager, one of the case managers, myself or my coworker, will contact them, and we'll set up a meeting with them.
Okay.
To where there's a series of questions that we'll ask them to get a gauge, to find out what it is that they're actually wanting to be educated on.
Right.
And then we set up, depending on the level, there'll be meetings, whether it be twice a month or monthly, that we check in with them, that we talk to them, we call them up, and we meet with them, and we can meet with them wherever they feel comfortable at meeting, because we want them to open up. We want them to be able to discuss these things so we can be able to better help them.
So do they have to go to the Department of Health?
They do not.
Okay.
They do not have to come there. We're mobile. We'll go. We are out on the streets, and we travel to wherever they're comfortable, where they want to talk. So I meet in McDonald's. Like I said, I've met at parks.
Well, there's only Kevin, this is wonderful, but there's only two of you.
Correct.
How are you doing this? I mean, let's say Sally wants to learn about this, and you say, okay, I'll come to you after school, or the McDonald's, whatever. Do you also try to get 2 or 3 other people that have in the same meeting?
Well, not necessarily in the same meeting, but you would try to maybe in the same location, and we'll try to space it out. Usually, it takes anywhere to talk to them 45 minutes to an hour or so to talk to a kid, and sometimes it's longer. But you try to space those appointments out, and then, like you said, yes, because of the times of school or whatever. High schoolers get out earlier, so we're able to space those at that time.
Gotcha.
And then if it's a middle schooler, they get out a little later, so we've got the later part of the day. So it usually works out like that for us.
Okay, and if you were to sit down and I said, I want to learn everything you have to tell me in the next week, how many hours would it take? How much information are you giving them?
Yeah, there's a lot of information that I don't know if it would take, it wouldn't take a week. That's why it usually takes
8 hours maybe? 6 hours?
It would take a lot, like at least 8 hours.
Really?
If we were doing it, talking about it in that time
That's what
frame,
I mean. I mean, if you had one, okay.
Yeah, if we were talking in that time frame, but usually that's why we try to space it out and talk, because usually what happens is once we gain the trust of a young person, they will open up, and they usually talk about everything that's going on with them and everything that's happening with them and stuff. But we do have some topics that we try to stay within to discuss and try to educate them and ask them, what's their knowledge? What's your knowledge of this?
Yeah, what do you think will happen if
this happens? Correct. So we give them those scenarios, and so we get some dialect to figure out those things. And then if we hear something that may not be true, something that they've heard from somewhere else, then we're able to then correct them and educate them on the proper way.
Now, before this show started, we were talking about some statistics. And when you think of age, you immediately think of adults. You do not think of teenagers.
Right.
I mean, you don't want to think of it, I'm sure. What is the rate of HIV/AIDS for the teenage population in our area, if you know?
Well, the actual physical numbers I do not have for this
Right.
the new quarter, but I can tell you at one point in time we were St. Lucie County
Oh, I know.
was, and as a lot
Yeah.
of people know, was very high among the state as well as in the country.
Right.
But as you said, those reported statistics were about through adults. But for the teens, the numbers are really, really down now. And I wish I had all those actual physical numbers. I did try to get them, but I didn't get them in time enough for this. But they are down. And I'm not saying that just to be saying it, but they are from 93 to now in 2002.
It's a marked difference.
It's a remarkable difference. And I do believe it's because of the education. Correct.
Right.
I believe it's because of the adults seeing that this was an issue and has been an issue among teens, and that they are seeking programs such as ourselves and other programs that deal with that, and allowing them to come in and to be able to educate the kids and give them some additional information on top of what they're able to give them.
So what's the most burning question these teens are asking? What's the yeah?
Yeah, well, that's a good question. And one of the most burning ones is, or one of the things is, all the kids think they can tell if a person has HIV. Okay. By looking at them.
Okay.
They think they can tell. And then we tell them, no, you can't. And unless someone discloses their what they have, or I always tell them, unless someone has it stamped on their forehead, you can't tell. I said you could be, and I always use I'll say, like, give me one of the best looking actresses you think that's out there, and I'll get either Halle Berry or Scarlett Johansson or those those type of people. I said, well, you could have someone who looks just like that who is HIV positive, but you would never know unless they disclosed it to you. You wouldn't know. And we've heard all kinds of myths on how they can tell, because all the people are sick, sickly and all this type of stuff. Well, we tell them that doesn't necessarily happen in the early stages.
Because you can, and this is an important question, you can contract AIDS from somebody, they don't have to be, and I want to make sure I'm using the right terminology. They don't have to have full-blown AIDS to be able to get the HIV virus.
That's correct.
From somebody, correct?
That's
correct. So the idea of looking at somebody, they could have just contracted it,
correct.
Be HIV positive, and not have a symptom.
That's absolutely correct. And that's what we try to educate our young people about. Because also letting them know about HIV, which is the virus, then afterwards is the AIDS. So a lot of young people didn't know that. They weren't aware of that. But it was something that people didn't want to talk about to the kids, to the young people. They thought, for whatever reason, maybe they were too young to know about that, or whatever the case may be. But they needed to know that because these young people were out there and they were engaging in the activities and engaging in these things that were putting themselves at risk for contracting the HIV virus.
Now, and you're not going to believe this, we got like 4 minutes left. It always happens. I mean, what's the second most burning question?
Second most burning question is, usually that I've heard is, hey, Mr. Howard, can I get in trouble for sending out pictures?
Oh, okay.
So that's been popular now, coming up. People want to know about the sexting thing.
Okay.
That's something that's coming out because, like I said, you have the technology now, and we're doing these type of things. So they want to know, would I get in trouble for that? And then they want to know if that's on a legal aspect of would they get in trouble.
Yeah.
And then we tell them, yeah.
Yeah.
So yes.
Yeah. Oh gosh. Okay. So if a parent is out there, they can't seem, I think what's beautiful about this is that oftentimes parents, even if they have a good relationship with their child, either they don't feel comfortable talking to their child, or the child doesn't feel comfortable talking. You need this third person to sit down and talk about the birds and the bees. So if do you have a long wait list, Kevin, or you probably do?
And it's getting bigger because of some of the agencies, the other agencies that are found out about us
Right.
and really actually now know exactly what it is that we are about and what we're trying to do. That we've educated them on this program. Now we're getting a lot of referrals and recommendations from agencies that work with kids in our demographics and saying, hey, this is important because they see that this is a behavior that they're displaying or
Right.
something that they need to be educated in. And so we're getting a lot of calls. We're getting parents that are calling saying, hey, I was told about your program through this agency, or I was told about your program through this agency. Can you give me a little more information about it? I have a son that I want to have educated. I have a daughter that I want to have educated. So we're getting referrals that way.
Okay, but if there may be a waiting list, there may be a little gap in time, but if somebody wants to set up the counseling or meetings with you, and quickly, it's not a life sentence, so to speak, right? If somebody can call you and say, "Can you talk to my son for an hour, Kevin?"
Right.
Yeah, right.
Right.
They don't have to go through the whole gamut. It may just be a short. Okay.
Someone could do that, and we would, but we would really like to get them the individual case management if we can, to just educate them through the whole process.
Right, which is, sometimes a little knowledge is dangerous, as dangerous as no knowledge
correct.
too. But if somebody wants to do that, they call the Florida Department. I'm trying to get the health department,
Right.
Florida Department of Health, and ask to get enrolled in the Teen Choices program, and it's free of charge.
That's correct.
Okay, and now if a teen is watching this, and let's say maybe they don't want their mama and daddy to know, but they got some questions, they can call you as well?
They surely can. They can call us as well.
And you have an assistant, the one I met earlier.
Oh, so that's actually my coworker.
Okay.
So she's the one that deals with the females. And
Okay.
she is the case manager for the females. So yeah, either one of us could answer any questions that you have.
And you primarily do that, the males go with you, or
Correct.
And the females
Correct.
go with her, well,
Correct.
which makes sense.
Yeah.
But
and then we sometimes have things where we interact, where we have things together, where we're doing classes or things like that.
Right. General knowledge things.
Correct, general knowledges and stuff like that. Or when the schools have now come, and some of the schools have asked us, they've taken advantage of what we're trying to do, and they'll allow us to come in, and we'll be able to do it at that point in time where we have both together.
oh, that's wonderful. Well, this is a great program. I am very proud of you.
Well, thank
Keep
you.
up the good work, and I'm sure we'll be referring some people to you, too.
Well, we hope so. It was a pleasure.
Okay, no, that's wonderful. Thank you so much.
Thank you.
Okay.